Welcome back. If you're joining us, you're watching Channel 1 News Hour. It's now time for us to focus on our interactive segment, Your Health. And our discussion this evening is family planning, a discussion that, of course, has always generated its emotions. Religious institutions, of course, opposing social issues. But today we'll be looking at it from a medical perspective and a little bit about the social issues around that. And for more insight, I'm now joined by Dr. Edward Sang, who is a gynecologist. Thank you very much, Dr. for joining us this evening.
Thank you.
Let's start with what is it that we keep referring to as family planning?
Well, it's a way of preventing pregnancy by a couple who are not ready to have a baby at that particular time. And so they use various methods to prevent that pregnancy.
All right. In terms of spacing out, children, when a family decides that, you want to have your children, is there a recommended period in which you should wait to have your second baby, your third baby, your fourth baby?
Generally, it's a decision of the couple, but generally we feel 2 years after one child is a good spacing so that the body of the mother can get time to recover and get back to where it's supposed to be. So that if the mother gets children too quickly, then the body may suffer.
Does this apply to normal delivery and or the cesarean section? Because I know these days many people are sort of moving towards cesarean sections.
I think it's for either. We don't mind whether somebody's having cesarean sections or normal delivery, but that spacing of 2 years is usually quite a good one. Yeah.
All right. Let's look at, what we talk modernly, that lately we've seen a lot of women preferring to go for the CS section as opposed to, the natural path. Is there any danger to that?
Not really. And nowadays, a lady is allowed to choose which method of delivery she would want. We do also have a lot of emergencies coming up. If the babies are too big or labor is taking too long, then we do cesarean section. So there's no harm per se, as long as it's done in a place where they are able to do it. Yeah.
So you can opt to go for CS even if you have that. There is nothing medically challenging.
Yeah, some ladies opt not to try normal labor, which is okay. A small number, but the majority, of course, still aim for normal delivery.
Yeah. All right. In terms of the health issues, when you talk about the family in itself, the social aspects of it in planning their family, what would be the best way you would advise a family when it comes to contraceptives?
Well, usually either before getting a child or after, we usually have a clinic where we discuss family planning, such that because once a lady has delivered, the fertility comes back actually much sooner than many people think. So usually 4 to 6 weeks later, we advise them to start family planning. Some take time to 3 months, 4 months, and find they're pregnant when they're not ready. So we try and assist them so that they get the child when they're ready. So we don't get somebody who has a 3-month-old child and they're already pregnant.
So how soon should you start contraceptives after delivery?
Usually 4 to 6 weeks. 6 weeks latest, but 4 weeks I would prefer even to start at 4 weeks.
At 4 weeks.
Yeah.
All right. There's always been this perception that if you're breastfeeding, then it sort of acts as a natural contraceptive. Yeah. Is that true?
No, not really. It does reduce the fertility, but not 100%. So yes, we do have many ladies who, when they're breastfeeding, they don't get periods. So they may have this mistaken belief that they can't get pregnant. But 4 to 6 weeks after delivery, in some ladies, the fertility comes back and they start ovulating. So there's a possibility of getting pregnant.
So the advice would be immediately 4 to 6 weeks.
Yeah.
What about in terms of men? Because most of the times when we talk about family planning, we only think about, the woman.
Yeah.
Nobody talks about men.
Exactly.
What are the available options for men other than, perhaps what we would say the use of condoms?
Yeah. For men, actually, you're right, not too many options. So it's mainly the condoms and also permanent contraception with vasectomy. And I'm happy to say that actually more and more men are asking about vasectomy and going for vasectomy. And it's a good method, and it's now quite available.
I can just see Ben just looked at me like, more men are going for vasectomy. I mean, what do the numbers look like if you compare it to, a couple of years back?
No, it's quite impressive. There are places where they're doing 30, 40, 50 a day.
In Kenya?
In Kenya, in Nairobi. And so more and more men are coming out and saying, I want to do vasectomy. And so it's a quick procedure, painless, and very effective. And so more men are coming out to do it. Yeah.
What about women? Because they also have that option. Are they taking it?
Yeah. Contraception in Kenya is actually quite well taken up.
And I'm talking about the permanent contraceptive.
Oh, permanent?
Yes.
Yes, we do get a number. Those who've had 3, 4, 5 kids, when they feel those are enough, then they do have a permanent. We try and avoid doing the permanent methods in younger ladies because we do have some regretting it later. So somebody can do the permanent one at 30, then when they get to 40, they realize they wanted another child.
What they call was ukumbuka.
Yeah. So a reversal is a bit difficult. Yeah.
So what is the recommended age for if you want to go for permanent? Above 40 or the number of children is what mostly?
Generally, you look at the number of children and the age. Because a lady who is 30 may not be thinking the way she would think when she's 40. And so we do get people later on regretting. So as long as they've been counseled, they've thought about it, the spouse is okay with it, then we would offer it. Yeah.
In terms of, the myths that surround, I want to go back to vasectomy, the myths that surround vasectomy that, what you've had. I don't want to really mention it because I know we're on national TV, but what are are there any side effects that are involved with vasectomy or what are the, the benefits?
Well, side effects, like any other family planning method, is a failure. In other words, you think you are not going to get more children, but it fails. Fortunately, that is quite low.
What percentage, perhaps?
It's less than 0.5%, so very, very few. And then no major side effects. There might be a little pain in some people, a bit of swelling, a bit of... that would just be for a few days. But most people, after a while, they're quite back to normal. It does not affect libido, so there's been a mistaken belief that it affects libido, but it does not.
It doesn't.
Yeah.
All right. In terms of when it comes to family planning, do we see couples coming together, to the clinic? Do you see a man and his wife coming to ask about the available treatment options, or people just play it? Leave it to the woman alone, or the man just walks into the clinic and says, I want a vasectomy?
Yeah.
Because...
Well, more and more we are getting the couples coming together. Though we still have a few ladies who come on their own. In the younger couples, they most of the time come for even antenatal clinics together. The spouse is there for the delivery, and they come for the postnatal clinic. So we do counsel them together. And so it's a decision they make together. There's no method we say is better than any other as far as the scientific contraceptive methods. Natural family planning, failure rate is quite high. But there are those who, for religious purposes, would use that. But we'd advise them that the failure rate is much higher.
It's much higher. At what percentage has it been put?
About 18% failure rate, which is quite high compared to the others, which is 0.5% and less. Yeah.
What are some of, the most common, contraceptives that women opt for?
The commonest is the coil, all over the world. And then the pills. Then we have implants, the ones we put in the arm. We also have the patch now, which is becoming more and more popular, which is like an elastoplast you just put on the skin of the lady. So those, and the injection again is quite popular, the depot.
All right. In terms of when to use this particular contraceptives, because statistics have shown that women as early as 15 now are actually engaging in sexual activities. What would be some of the contraceptives that are recommended for perhaps a woman who hasn't given birth as opposed to one who has given birth?
The depot, the injection, the 3-monthly injection, usually is discouraged for a lady who has no children because one of the side effects is delaying the return to fertility. So a lady, when she stops it, it may take long for her to get pregnant, even a year or two. And in our society, that can cause a lot of stress. And it's just the side effect of the contraceptive. The coil also may not be the first choice for a young girl before giving birth, but it can be used, while the others are generally available to be used.
So for those particular two, which you're saying, if you haven't given birth yet, you shouldn't go in that direction. All right.
Yeah.
And just looking at, the negative, perceptions that you've had to deal with, in your line of work, what are some of the major issues that you've had to tackle?
Well, some people relate some of the contraceptive methods to cancer. So they may say this one causes cancer, while they do not. The failure rate at times is discouraging. So some ladies using a method get disappointed when they get pregnant, even permanent methods. And then the natural. So some people, when they get pregnant, it's quite disappointing for them. Yeah.
Let's talk about the use or misuse, if you like, of emergency contraceptive.
Yeah, emergency contraceptives contain quite a high dose of hormones. And so if a lady is using them quite frequently, she needs to use a more regular and continuous form of contraception. So emergency is for an emergency. It's not to be used every other time. So if a lady is using it more than twice a month, then generally she would rather use something else which has less hormones. Also, the effectiveness may not be as high as they think. Yeah.
All right, so between two times in a month. All right, I'm being told we're running out of time, but in terms of your advice to young people, women particularly, when it comes to contraceptive, what would you tell them would be their options?
I think it's something which has to be thought about seriously and used in a couple, because getting a child when you are not ready and you haven't planned is something we try to avoid, so that we avoid the issues of termination of pregnancy, abortions, we avoid conflict in the family, and we avoid somebody taking care of another child while the other one is still too small. And with our rates of poverty, nutrition may be a problem, and so one child may lose out.
Is there, a huge uptick in use of family planning because of, cultural issues, religious issues, and also the myths and misconceptions surrounding it?
No, I think the uptake in Kenya is quite good. So we have a lot of people using contraception.
A lot of people using it.
Yeah.
All right, I'm informed our time is up, but thank you very much for just giving us insights on how, family planning methods that are available and how to use them. Well, that is Dr. Edward Sang, a gynecologist, just putting into perspective the available options for you, and of course saying that it is something that a lot of people are using, and particularly for me, is that men are now taking up vasectomy as an option for family planning. So that is a good thing, as much as Ben is looking at me to suggest that that is not going to happen anytime soon. But that is where we put a cap on your health this evening. Up next is the business news. Stay tuned for that.